Welcome to the Fit Strong Women Over 50 podcast, episode number 186. Hi, I'm Jill. Thank you for joining us today.
And I'm Chris. Jill and I are your hosts for this podcast and the founders of the Becoming Ellie community.
If you're wondering why we decided to name our community Becoming Ellie, it's because Ellie was the Norse goddess of aging who beat Thor in a wrestling match. Chris and I thought we want to be like Ellie, fit and strong as we grow older.
You can find out more about the Becoming Ellie community and this podcast at our website, becomingellie.com. Ellie is spelled E-L-L-I, and you can also sign up for our newsletter while you're there.
Hey, Chris, don't we have a call out for today?
Yes, we do. Thank you to Virginia. She sent us a monthly coffee donation and said, "I loved your workout, Chris. The warm-up inspired me. I'm adding that intentional warm-up before my morning walk. And thanks for your podcast, too. I've been inspired with each episode."
Wow, that's exciting. And I guess I want to say that the walkout Virginia's referring to was a blog post you made the other day.
The workout, yes.
Yes, the workout. What did I say?
Walkout.
Walkout. Chris walked out on the podcast.
That's okay. Well, the thing that I got very intentional about was warming up before I do the workout. Like I'll do that when I do a group exercise class, but the whole little marching thing, tin man things, and it's easy to skip that part of it and just go right into a workout, which is how you get hurt. So I really don't want to get hurt.
Good. Okay. Well, so that's what she was referring to.
Right.
It was a good blog post. So thank you for that. And thank you, Virginia. We really appreciate your support.
Yes. Thanks so much. So today we're talking about thyroid health, and I learned a lot from this one. Let's go to the podcast.
We're thrilled to welcome Dr. Angela Mazza. She's a triple board-certified endocrinologist and the founder of the Metabolic Center for Wellness in Central Florida. She's also the author of Thyroid Talk, an integrative guide to thyroid health, and co-host of the podcast Thyroid Talk with Dr. Angela Mazza.
Dr. Mazza is known for her integrative, personalized approach to care. Her work helps people understand how their bodies function so they can truly thrive. Welcome, Dr. Angela. Welcome to the podcast.
Oh, thanks so much for having me, Jill and Chris. It's wonderful to be here.
Oh, we're so happy that you could be here. Can you start with what exactly is an endocrinologist and what drew you to this specialty?
Oh, that's a great question, especially one to start with. So endocrinology is a big, long word, but basically it's the study of all things hormones. So endocrine is like our endocrine glands or different glands that make hormones. So hormones are really those countless chemical neurotransmitters that deliver messages to all parts of our body. They are super, super important. Without hormones, we wouldn't be able to kind of do all the things we do on a day-to-day basis. I went into endocrinology originally because, one, I think as doctors, we go through training, you figure out what you don't want to do, like most things in life, right? But I was one of those, I went in my surgery rotation. I'm like, nope, not doing that. OB, nope, not doing that. But all kidding aside, diabetes runs in my family. So diabetes falls into the endocrinology spectrum because insulin itself and the hormones that control blood glucose are hormones. So I went into endocrinology for that fact. But when you think about the field of endocrinology, it covers a lot of widespread areas. So diabetes, type 1 and type 2, that's just one of them, but thyroid, which is kind of like a focus of what I work with on a day-to-day basis, is a hormone too. And it's a very important hormone because it's a hormone of metabolism. But if you think about like our sex hormones, our female hormones, our male hormones, cortisol is our stress hormone, hormones that can control our bones, just that affects osteoporosis, you name it. Pretty much everything in our body is going to be affected by hormones, and some hormones are more important than others. So long story short, that's kind of what endocrinology is.
Okay, great. Thank you.
Right. So basically everything.
I'm a little biased. It does affect me.
Well, I think today we would really like to focus a lot on the thyroid gland. So could you start by telling us where in the body is the thyroid gland and what does it actually do? Is it
Sure,
a
great.
gland or is it a hormone? I'm not even sure.
Yes. So this is a great question to start with. So the thyroid itself sits right on the front of your neck, like right above your clavicle. Some of it will be behind your clavicle, but most of it's right in front of your windpipe. And it's kind of a butterfly-shaped gland. But the gland itself is what makes thyroid hormone. So the thyroid makes thyroid hormone. So its job is to make this hormone that's so important that controls everything metabolism related. So that's the thyroid makes thyroid hormone, so that's its job.
So we hear a lot about thyroid issues becoming more common with age. Is that correct? Are changes to the thyroid more likely as we get older? And does perimenopause or menopause play into that? And are
Yeah.
women more likely than men to have thyroid issues?
The thyroid hormone affects anything metabolism related. So metabolism are like all these countless enzyme reactions that affect how we think and we grow and we move. And as we age, hormones do change. So as we age, we experience and we have experiences that are going to affect how our thyroid works. So it is more common to see as we age more thyroid issues, mainly like underactive thyroid, but we tend to see more autoimmune thyroid issues. So autoimmune thyroid is the most common type of underactive thyroid. So that's something called Hashimoto thyroiditis. So autoimmune just basically means our immune system is triggered over time to start working against our own thyroid. So the thyroid's not able to keep up with the demands that it needs to. Now, as we age, both men and women, we can have more thyroid issues, and there's some debate about the lab evaluation being accurate as we age, and that gets into the whole longevity conversation. But as women in particular, as we make less estrogen and progesterone, that in turn can affect our thyroid function because as women, our immune system goes through huge swings as we age. And estrogen, as well as progesterone, do impact our immune system. So when we start making less estrogen and progesterone, that can in turn affect that autoimmunity we can see that can go along with an increase thyroid issues, especially Hashimoto thyroiditis as we age. But that being said, men do get thyroid issues too. It's just not to the same extent.
There's probably some common symptoms of a thyroid problem, things that maybe a person might chalk up to something else, but they might not immediately recognize it. What would those symptoms be?
Right. So, and the thing about thyroid issues and thyroid symptoms is they can overlap with a lot of things, and they can kind of creep up on us over time. And specifically as women in particular, we tend to like kind of put things aside, like that's just an off day, but most common symptoms involve energy. So if we notice that we're developing more and more fatigue over time, getting a really good night's sleep but not feeling rested, that can be a common symptom that goes along with thyroid issues. Brain fog, that's a huge one. So just brain fog can be not just like forgetting your keys here and there, but really we can start doubting ourselves if we're having a lot of brain fog, because we don't trust ourselves as much because then we start double checking because we kind of in that kind of fogginess. Skin and hair changes are pretty common with thyroid. So hair thinning, hair loss, dry skin are pretty common with underactive thyroid and thyroid issues. GI issues are huge. So the gut thyroid conversation actually goes both ways, but constipation is pretty common with folks with thyroid, mainly hypothyroidism. Sometimes people have a swelling in their neck because the thyroid becomes enlarged. Not always, but those are kind of the most common. But then there can be like uh, fertility issues, cold intolerance, weight issues, having trouble losing weight despite like kind of diet and exercise. So just think about um, thyroid hormones. Thyroid hormone receptors are on every cell of our body, so the symptoms that can go along with it can be pretty far-reaching.
And yet all of those are things that if you go to your doctor and say, I'm fatigued and I have brain fog, and they may test you for thyroid issues, and it comes back you're fine, so you still have fatigue and brain fog, and now you don't even know why, like, now you're on a mystery tour.
Right, and that's where the challenge is, and I myself try it and educating even physicians and providers is the screening tests that we have for thyroid are really not the best. So TSH or thyroid stimulating hormone, that's what your doctor is going to check to kind of screen. It doesn't really give you the full picture because it's not a direct measure of thyroid function. It actually comes from your pituitary gland. So in an ideal situation, say if you were not making enough thyroid hormone, the TSH actually should go up to try and stimulate the thyroid to make more. But especially in the setting of autoimmune thyroid issues that may be kind of evolving, that TSH is going to miss a lot. That's why it's so important to get a complete thyroid panel because that it gives the full picture of what's going on with your thyroid. So, like a complete thyroid panel would include not just the TSH, but like T4 and T3, which are the thyroid hormones. There's a measure called reverse T3. Reverse T3 is the inactive form of thyroid hormone. We don't want a lot of that. Thyroid antibodies, which help us detect autoimmune thyroid issues going on. And I tend to check a lot of like micronutrients too, because the thyroid needs certain micronutrients to work well, like iodine, selenium, iron. So there's a lot more to it than just the TSH. And unfortunately, say you go to your doctor and they say, oh, your TSH is normal. Well, that range is pretty wide, first off, and it doesn't give the full picture sometimes.
Yes, especially if it's really actually the pituitary gland. And you said it would be a reverse.
Yeah, ideally, you should see a high TSH if your thyroid's not working right.
Interesting.
Yeah, but it could
Interesting.
just
Yeah.
be a high on the upper range, and we're missing it's very subtle. It can be very subtle in a lot of people.
So is it the kind of thing that when someone diagnoses a thyroid problem, they really need to do the T3 test, the T4, and some of those others? And so how do you nicely ask your doctor to do that if
This I know. It's and it can be challenging because I know I'm an integrative endocrinologist, so I take into a lot of consideration. In a traditional kind of primary care setting, it can be challenging as far as, your doctor only has so much time. Like you got like this, but going in prepared and educated, and patients are becoming more and more proactive about their health now. They're listening to shows like you guys have. They're learning, they're proactive. So there's no harm, and I don't think any physician is going to take offense if you come in and say, "Hey doc, can you just add this on to my labs because I feel like maybe something's off." And if you come at it like that, most physicians are going to be pretty receptive to
And
that.
these are tests that they would know about even if they don't routinely order them.
They should. They should. At least the free T4 and free T3.
Okay.
They really should. And you can get them at Quest or LabCorp or wherever you get your labs done. I mean, they're readily available. They're not like fancy labs.
Yeah. Okay. So we talked about the sort of physical symptoms of thyroid issues, but does the thyroid affect our mental health or, like emotions, anxiety, depression? You said brain fog.
Yeah, the brain is rich in thyroid receptors. So, very, very commonly we see mood changes when the thyroid's off. It's not uncommon to see depression in folks with underactive thyroid and overactive thyroid, which is kind of the exact opposite. So, think the polar opposite of moving slow, it's moving fast, can go along with anxiety. And it's become and we're talking about it more in the medical community is that we really someone who presents with depression should be screened for thyroid issues, and someone with thyroid issues should be screened for depression. Because unfortunately, there are a lot of people that are labeled with depression that are actually a thyroid issue. And if you fix the thyroid, then in an ideal world, some of the mood changes should improve. So we are,
Ah,
yeah.
okay. So if you're taking the antidepressant, you might be feeling better, but you're not actually resolving the problem.
Yeah, and I don't know if you ladies have had the experience of any loved one being on. It's hard to get off of an antidepressant.
Right.
Yes, it is, right.
Yeah.
You can't go cold turkey, that's for sure, I know that.
Oh, no, yeah.
Yeah, it's a tough thing. And
And it's a label that you've been labeled with too, so
right. Well, yeah. So we hear a lot of terms thrown around, but can you break down the difference between hyperthyroidism and hypothyroidism?
great question. So hypothyroidism is underactive thyroid. So, and hyper is the exact opposite, so that's overactive thyroid. Now, I have patients who I treat with hypothyroidism because, some of their symptoms, like we mentioned, could be, trouble with their weight, fatigue, um, feeling cold. But on the other end of the spectrum, uh, think about metabolic overdrive. So we're running in the red, if you will, and that can be like losing weight. Although some people gain weight when they are hyperthyroid, feeling really hot, feeling anxious, heart racing, trouble sleeping. So they are two polar ends of the spectrum as far as symptom wise, but both most common cause are autoimmune causes. So whereas Hashimoto thyroiditis is the underactive autoimmune thyroid, so the hypothyroid part, overactive is something called Graves' disease. So that also is autoimmune. Though both actually can occur in the same person at different points in time.
Oh, wow. That makes it
Yeah,
even more confusing.
I know. Yeah, I mean, talk about like swings of the spectrum. But yeah,
So my husband had hyperthyroidism, and he kind of liked it because, one, he insisted he got taller from it, and it did help with his weight. So, but his doctor was pretty insistent. No, you can't just let this go untreated. But I'd never been seen someone saying like, I really kind of like this.
well, I mean, some people it can feel like, hey, I got all this energy, but after time, it can really wear on you and cause fatigue.
Yeah.
But like, I'll have hypothyroid patients say, I wish I was hyperthyroid. I'm like, no, that's a whole nother ball of wax. You don't want
We just want to be healthy in the middle.
even. We want to be
Yeah.
even.
Moderate, as they say. Everything
Or
in
in moderation,
moderation.
right?
Right.
Balance.
Before we talk about diagnosis or treatment or whatever, I'd like to know, what are some of the biggest misconceptions that you hear from patients or the general public about thyroid disease?
Hmm. I think a lot of the biggest misconceptions are that labs tell the whole picture, at least in the medical community. So, just like I mentioned, TSH, a person's not a lab. A person is a person with symptoms. So, as I educate like other doctors and providers, I always tell them that one does not exist without the other. So you can't treat someone just on labs alone. You have to look at how they're feeling. And we're learning more and more that when we look at genetic studies, that they're actually our genes are going to dictate where we fall in some of these ranges. So it is super important to put symptoms together. And I think it's also a common misconception in the general public, like if you're being treated for a thyroid condition, that you're always going to have that. That's not true. There are cases where some thyroid issues are temporary, and that we can treat them very well. Say in the case of if it's just like low iodine, we can fix that if that's the case. But oftentimes, even with autoimmune forms of Hashimoto thyroiditis, in integrative fields, we really look at the whole person and work on, stress management that plays a huge part in thyroid function, our gut health. Um, we put this all together, and actually, we are pretty successful in some cases, depending upon the person, getting people off of thyroid medicine or thyroid hormone replacement, rather, I should say.
So I know a number of people who have had their thyroid removed and then they go on lifelong medication and they have to adjust it periodically. Are there other treatments besides surgery that people can consider? Or, I mean, I don't want to say people are having surgery that they don't need, but it just seems like there's an awful lot of it, and I'm curious about that.
Well, that actually is a really great question, Jill, because it depends upon the reason why we're considering thyroid surgery. So when I completed training, there were certain things that patient had to have thyroid surgery. There was no other option. Like say a big nodule, nodules, a mass within the thyroid that was continuing to grow. Say if you had hyperthyroidism, that was one of the treatments, and it still is. If you had cancer, you had to have your thyroid taken out. Now we have non-surgical options for some cases in this case because when you take out someone's thyroid. Uh, you're on thyroid hormone replacement for the rest of your life. And we're trying, in essence, we have to recreate what the thyroid was doing on its own with pills. And that's never going to be the same. So now we have non-surgical options like something called radiofrequency ablation. So that's a non-surgical option we have that actually we do right here in the office. It shrinks thyroid nodules. Some cases we can treat small thyroid cancers with it, and that takes people away from having to have surgery and being on thyroid hormone replacement for the rest of their life. So it is kind of a big advancement in the world of patients needing to be on thyroid surgery, having thyroid.
That's encouraging.
Yeah, I mean, there are other options now, and again, we're trying to educate the medical community about these other options. And these procedures are very patient driven. Like patients are looking for other options other than having their thyroid removed.
How long does it take after you've received treatment to start feeling better?
If you're being started on, say, for underactive thyroid, yeah, it depends. It depends. It depends upon where the point in time we were starting. It
I
can,
figure it depends, right?
you know, it can
Do you
be
take your medicine?
yeah. Usually if someone's, I always try and manage expectations, but usually within a few weeks, once we get someone on the right dose, they start to feel better. And then that's where the follow-up in the office is important. So I recommend rechecking levels, reevaluation in the office in 6 to 8 weeks after any change in sort of thyroid therapy.
I have a question that this is probably kind of obvious, but when you were talking just now about surgery, it made me think about it. Can you survive? Can your body survive without your thyroid?
That is that's an interesting question. We can. So there's hormones we can't survive. The only hormone we cannot survive without is cortisol. So cortisol is our stress hormone, and that helps us get through stressful situations. So if you have something called adrenal insufficiency, um, you don't make cortisol, so you cannot live. You can live, I mean, not too long without it.
Okay, I didn't know that.
Thyroid, you could live a while without it, but then you would go into this very, very hypothyroid state called myxedema coma. And then that's just it's you don't survive past that point.
Okay, all right.
So
So
like say if you didn't have a thyroid and you only took your thyroid medicine. I don't want to put this out there. If you didn't take it for a couple of weeks, then you took it for a week, you wouldn't die.
but if there's a zombie apocalypse and they quit making medication,
Yes. That's where you need that stockpile. So you have your doomsday account, like with your thyroid medicine in case the
I'm
zombies.
sorry, my mind goes there sometimes. Like, so okay, good to know.
So people out there just don't.
Take your medication. You're not going to die, but your
A
life
couple
will
of
be
days
much
here and there is
improved.
not the end of the world.
But life is you will feel much better if you take it.
Life will be better.
Yes. Okay. Good. And can we prevent thyroid issues, or is there anything we can do to have, can we do something to have a healthy thyroid?
Yes. Actually, it's very much in our capability. Yes, there are genes that may predispose us to having thyroid issues. There's things that we can I kind of call it our thyroid biography that we're exposed to over time that can impact our thyroid function. But things that are very much in our control are trying to keep inflammation levels down. So eating a good diet, like a Mediterranean diet, you can never go wrong with because it's rich in the micronutrients that our thyroid needs to function well. It's great anti-inflammation, like healthy fats, good veggies, lean proteins. You're never going to go wrong with that, and that's going to help your thyroid. Good gut health is super important. So that anti-inflammatory diet does help with your gut too, because our gut and our thyroid have this very tight interconnection. So if our gut's happy, our thyroid's going to be happy. Those are two things that are very much in anyone's control.
Yeah, I hear so much about the Mediterranean diet these days. It
Oh
seems like it's
yeah.
the answer for many of the different things that could ail us. And
And staying away from like ultra processed food. So I mean, there's nothing in that that's good for anyone. So
Basically, the same things that we would do to have a healthy brain or a healthy heart would help us have a healthy thyroid.
you're exactly right.
Okay.
we did talk a little bit about stress, and I'm wondering what's the connection between stress and how does that impact thyroid health?
Oh, yeah. So stress really impacts thyroid function every single way because when we're under stress, it really impacts how our thyroid makes thyroid hormone, how our thyroid releases thyroid hormone and converts thyroid into active thyroid hormone, T4 to T3. T3 is the active thyroid hormone. It affects how our brain sends those signals to release thyroid hormone. So it really, really does impact us on many, many levels. So cortisol comes from our adrenal glands. So the adrenal glands sit on our kidneys and they make a number of different hormones, like our fight or flight hormones, hormones that control our blood pressure, and that's where the cortisol comes from too.
If there was a connection between the cortisol and your thyroid.
Oh yeah, there's a definite there, and really, it's tough to look at thyroid function in a lot of people without looking at cortisol too.
You just mentioned there's a genetic component. You could be at increased risk of thyroid if you have certain.
Yeah, definitely. So there's different genes that predispose us to having thyroid issues. But if you think about anything gene related, those genes have to be turned on. Just because you have genes doesn't mean that those are going to be activated. So yes, 100%. Yeah.
And the autoimmune thyroid issues, would they fall into that category as well?
Yes. Yes. There are people that are predisposed to autoimmune conditions in general. Thyroid autoimmune conditions just tend to be more common. But it's the same genes that dictate us to get celiac disease or you name it, any autoimmune condition out there. They tend to be run in packs, and they just have to be turned on, unfortunately.
Okay. I just was curious about that.
Yeah.
Yeah, at the beginning of our talk, you talked a little bit about diabetes, and I wondered if diabetes and the thyroid disorders are related in any way.
They definitely can be related. We tend to so diabetes is on a couple different levels. So type 1 diabetes does fall into that autoimmune spectrum.
Okay.
So it's an autoimmune condition for the most part. Persons with type 1 diabetes are at increased risk for having autoimmune thyroid issues. Now, type 2 diabetes tends to be a very inflammatory state, and that inflammation is what drives the thyroid issue. So, lots of times, if you get the diabetes under control, as far as type 2 diabetes, the thyroid issue becomes under control too, or more manageable.
Yeah, that makes sense. That does make sense.
Type 1, what did you say? Type 1 di
So, type 1 diabetes is usually an autoimmune condition. So, it's an autoimmune breakdown of the beta cells in the pancreas that make insulin.
Right,
Whereas type 2 is more of it's a combination. It's there's
right.
lots of
So,
factors.
if you already have the autoimmune disorder going on with your pancreas, you could have a greater risk of having. Once you have an autoimmune disease of any kind, you sort of seem to be at risk for getting
Yes,
more.
yes.
I wanna ask another question about that. What kind of doctor do you go to see if you're having autoimmune issues?
That's a great question because it depends upon the type. We tend to think like autoimmune and like rheumatoid arthritis and lupus, and those fall into more rheumatology. Whereas autoimmune endocrine conditions, an endocrinologist usually takes care of.
Okay. And if you had multiple different things going on.
Yeah. So if you have a little bit of everything, I
Yeah.
mean, you might have a rheumatologist and an endocrinologist.
Okay.
I know it's kind of confusing, and there's like there's an overlap, but they're separate at the same time because the rheumatologic autoimmune things are a little bit different.
Well, and I have skin issues, and as soon as, like your dermatologist, as soon as you say anything is going on anywhere else in your body, they're like, "Well, that's not me." Um,
Oh yeah, yeah.
like
Yeah.
even this is now going into my ears. Well, go see an ear doctor, you know.
Got you. And that's where, integrative medicine and functional medicine, because we tend to look at the whole person and really, because if you get your immune system under control, it does help with so many things, including, skin issues or like dermatitis, vitiligo, those sorts of things.
All right, and that's a good point is that it's like
Oh,
you do
definitely.
integrative medicine.
Yeah. So
Okay. Which
it's
okay.
a little bit separate. Yeah.
Yeah. Okay.
Yeah, it does seem like if you have a lot of inflammation, it affects so many different parts of your body, and,
It's
yeah,
really the
so
root of everything, you know,
yeah, yeah.
inflammation.
Yes. It's like money, the root of all evil.
I know.
The gut health. So you brought that up a couple of times, but what's the connection between our gut and the thyroid, and how do you make that relationship better?
Sure. Yeah. So our gut is really the super important, really semi-permeable barrier that we take from our external environment, like we take in food and things from the external environment, and try and bring it into our what we need out of that into our internal environment. So we want to be able to get in nutrition and hydration, but we want to keep out like undigested food or bacteria, toxins, bad things like that we might come in contact in our gut. So when our gut is disturbed, things are getting into our system that are triggering our immune system. And unfortunately, that can trigger autoimmune conditions because the immune system almost gets like confused. And I should say, when there's issues with the gut, it can be at the level of the gut. So folks can have irritable bowel or and unfortunately can progress to inflammatory bowel disease like ulcerative colitis and Crohn's, but it can cause, autoimmune conditions. So like thyroid conditions can be that that gut issue can be that trigger that is a tipping point for developing autoimmune things. So, and by decreasing inflammation at the level of the gut, so eating food that's low in inflammatory components, like the Mediterranean diet, like we talked about, getting good probiotics, prebiotics. We have all sorts of healing things that we can heal the gut, but getting the gut in check is probably the most when we're dealing with autoimmune and that gut thyroid connection is probably the most important thing to getting things under control because it's like otherwise you're just giving someone a pill for hypothyroidism and you're not fixing the underlying cause.
So we just talked a bit about diet, but are there any supplements that you recommend to your patients that are dealing with thyroid issues or trying to avoid having thyroid issues?
Right, yeah, and there's never any harm in checking micronutrient levels, so that is helpful. Pretty much all my patients with thyroid issues are on selenium, so selenium really helps protect the thyroid. So the best form of selenium is called selenomethionine, and you take it in about 200 micrograms a day, or you can eat 2 Brazil nuts a day. So that has about the enough selenium.
Oh, I remember that. Eating the Brazil nuts. Yeah,
Yeah,
selenium.
so iodine you don't wanna take unless you know you're low in iodine, so I don't recommend anyone take iodine if they think they have a thyroid issue or if they think that they
What
should.
about salt with iodine in it?
Yeah, I mean, if you don't having blood pressure problems, then a little bit of salt, iodized salt does have enough iodine in it.
But it's not like you should be buying salt without iodine.
No, no, I mean, unless you don't know until you check your levels, so I wouldn't go out of my way to change your diet when it comes to the type of salt you're taking.
Okay. Now, Chris, you might not know anything about this either, but there's something about people in the Great Lakes region having an unusually high number of thyroid issues. And it has something to do with iodine, I think, but Do you know what I'm talking about?
Is it related to vitamin D at all?
No,
No?
it was related to something to do with iodine.
They used to call it the goiter belt in that kind of type of area because iodine was quite low, so people were developing, skin
Okay.
issues.
Interesting.
I had someone who was insisting that we were all in danger of having thyroid issues because of living near the Great Lakes.
Well, I guess like anything else, checking your labs makes more sense because you don't want to just take iodine if you don't need
Yeah,
it.
that
That would not
exactly.
be a good idea at
Don't
all, right?
guess, it's best to check.
Yeah, okay. All right, but you do know what I mean, that you've heard of that.
The
Oh,
goiter
yeah.
belt. I've never heard of that. I've heard of the rust belt, but never the goiter belt. Dr. Angela, your clinic is called the Metabolic Center for Wellness. What kind of services do you provide there? And do patients have to be located in Florida to work with you?
Well, as far as what we take care of persons with all types of hormone issues, and we kind of talked about a lot of hormone issues today. But then I specialize in thyroid issues, so anything from too much hypothyroidism, hyperthyroidism, thyroid nodules, thyroid cancer. Right now, the only new patients we're taking right now are related to thyroid nodules and RFA the the procedure I referred to for the thyroid nodules. But I mean, I do have an online masterclass that if people are interested, they can log on and find more about it. We go through all sorts of modules. We do testing, lots of online sessions. So that's kind of the next best thing. And we can always make references as far as how to talk to their doctor about, like you brought that up, Chris, talking to your doctor.
It has to be an unusual thing to be in an endocrinologist who's also doing integrative medicine.
Yeah, there's not too many of us around, but we are working on training more providers to be more adept in taking care of thyroid issues.
Okay. If we were having issues and we weren't being satisfied with what our doctor was saying, we might wanna take, like, at least the master class and
Yeah,
find out what I need to know to.
because yeah, we really talk a lot about gut health, how to approach it. We do testing and all sorts of good things. So we talk about stress and we check for cortisol levels, and it's kind of it really is I think we've gotten good feedback that people feel educated and they feel empowered to do what they can without just, relying upon medicine too.
So you've also written a book and you co-host a podcast on top of running your clinic. So why is it so important for you to help the patients understand their thyroid health? I mean, obviously you're passionate about this.
Yeah, because kind of the exact thing we were talking about. There's only so much of me, and we do want to educate other providers, but I do want patients to have correct information. They want them to have good information that they can and feel like there are things that are in our control to take care of. That they can feel there are things lifestyle wise that we can do to help ourselves. It doesn't have to be super complicated. And I do tell my patients, if you're not happy with your provider, you really should get another opinion. So education is key.
Yes, that's probably true with a lot of medical things, is that second opinion is often not a bad idea.
Yeah.
So you also have a podcast. You have your own practice, you have this master class, you have a podcast, a book. What's the name of the podcast?
Oh, it's called Thyroid Talk with Dr. Angela Mazza. And
Okay.
my co-host and I, Dawn Sheffield, we kind of dig into all things thyroid, but we talk a lot about other things too.
Okay, and I assume that's everywhere your
Yeah, it's
everywhere a
available
podcast might be.
everywhere. We got YouTube, we got Apple Podcasts, Spotify,
Yep,
iHeartRadio, all the good ones.
yep. So wherever you're listening to this podcast, you can hear
Tune in for
Dr.
more
Angela's,
information on
yes.
thyroid.
Okay. Well, we'll be sure to put links to the book, your clinic, your podcast in the show notes.
Of
So that's
course,
great.
thank
That's
you.
great. That's great. So, Dr. Angela, it's been such a pleasure talking with you today. Is there something that you want to say to our listeners, something we forgot to ask, or is there anything else that you want to leave with our listeners?
Oh, well, thank you so much for having me. And I can't reiterate enough how important it is to take charge of your health because it actually impacts not only how you feel now, but years down the line. Because really the goal is you want a good health span. You want lots of healthy years ahead and resilience. So it's not just about the here and now, it's about years down the line. So and spreading important information like you guys are doing is invaluable. So I appreciate you.
Oh, well, thank you.
Yeah.
Thank you.
And yes, thank you too. It's been great having you join us.
Yeah, we've learned a lot today.
Thanks again for everyone listening. Until next time, take care and be well. Bye-bye.
Bye.
Dr. Angela really spelled out so many different things about the thyroid that I wasn't aware of. And I guess one of the things that really struck me as I reviewed my notes was how many symptoms, fatigue, sleeping but not being rested, brain fog, skin and hair changes, dry skin. Those types of things also are often perimenopause and menopausal symptoms. So it gets confusing. But then I guess that makes sense because menopause is also hormone changes.
Yeah, people talk about having thyroid issues, and I never really think about the fact that that's a hormone, or that the thyroid secretes a hormone. And it's interesting. I wish more doctors followed the integrative or functional medicine model because it would be really helpful to have someone
Right.
really help you figure out what is going on with various issues.
That reminds me of Karen Clark Snitchler's interview where she mentioned using Dr. Mark Hyman's functional medicine tests, which gave her a lot of information. I think it was over 100 lab tests twice a year, and it's $500. Has autoimmunity as one of the things that it tests for. So I know she really relied on that when she lost 100 pounds.
Yeah, that was a podcast episode earlier this year.
Right. I think it was episode 171.
Okay. The test that she had done was the company is called Function Health. So that was interesting. And yes, if you don't have a doctor to really help you, like in your neighborhood, that is a good way to figure out what's going on with your body for
Right,
sure.
because it's online. You can do everything online from what I understand.
Yeah, you go to your local blood draw
Lab.
lab
Yeah,
and get the
and
work
they
done,
take the blood.
yeah,
Right.
and then they give you the results over line. So I think that's a good point. If
Yeah.
if you don't have Dr. Angela down the street from you,
Right. Who's already so booked up she can only see people that are looking for RFA help with their thyroid.
yeah, that's something.
Yeah. Well, the other thing I thought about too was how the thyroid affects your mood. And so many folks get on anti-anxiety drugs or depression drugs trying to help their symptoms when actually the thyroid was the cause of it. And of course, you don't want to just stop your drug. You don't want to stop that. But if you can solve the symptom, what if it's something as easy as iodine? Of course, you don't want to start doing iodine unless you know that's the problem. But there's really a lot to the thyroid that I think it's overlooked.
Well, I'm thinking about that. So, I don't know about you, but I've had many doctors just sort of casually say, Here, I'll give you an antidepressant."
Yeah, here's some Prozac. Good. Zoloft or whatever. Yeah, I had the same experience and I was like, no, that's not my problem. I know that's not my problem. I can tell.
The whole cortisol thing
Yeah.
that she brought up, that was really interesting.
Yes, it was. Yes,
We
it
always
was.
think about cortisol as being like, the bad hormone.
Yeah. Well, having too much is definitely too much. Well, it comes with stress. If you can manage your stress, then you can have stress, but it doesn't take its toll on you, right?
Yeah.
And that's the smart thing.
I just always remember when I used to not carpool, I used to commute down this highway in Cleveland, and it was horrible, and I was constantly stressed and angry, and
Right.
finally I thought, "I can't live this way," and I worked really hard on practicing patience while
Uh-huh.
driving,
Yep.
and so that if someone cut in front of me, I didn't care, and it really made the trip more it made it a lot easier,
Yeah.
but it took
That's so
a
funny.
lot of work to get to
Yes.
that point,
Yes.
and
Oh
that's just
gosh.
one little part of life.
Yeah, I remember, especially when I was in Rhode Island and I had a commute. I had to drive out of Rhode Island into Massachusetts, back into Rhode Island to try to get to work, and it was like a 52-minute commute every day. And I remember experiencing a lot of the same things on the East Coast. The traffic's pretty tight, and I would recite different affirmations and prayers and different things, just trying to get my I always thought it was my blood pressure, but it was probably the cortisol.
Or both.
Both. Yeah, yeah.
Yeah. Well, I wonder actually, that's a good point. When people say, "I can feel my blood pressure rising," what they're feeling is your cortisol flooding
Yeah,
your
the
body.
adrenal the adrenal gland going to work.
So, if you're listening, let us know if you have any thoughts on our talk with Dr. Angela. Do you have any endocrinology stories or commuting stories you wanna share with us? We'd love to hear from you.
Yes, please let us know your thoughts. You can leave us a message at becomingellie.com, and you can also find us at Becoming Ellie on Facebook, Instagram, Pinterest, YouTube, and LinkedIn.
Also, please consider joining our private Becoming Ellie Facebook group.
Yes, and if you enjoy this podcast, you will probably enjoy Wendy Green's podcast. She is the host of the popular and inspirational Boomer Banter podcast. She pursues real talk about aging well. At Boomer Banter, Wendy explores financial literacy, mental and physical health, relationships, and having a purpose to help you age well.
I'm going to just say, too, that even if you're not a boomer, you might still find some information of value in her podcast. So
That's a good point.
you can listen to her podcast at her website, heyboomer.biz. That's heyboomer, Hey, boomer, all one word, dot biz, B-I-Z. You may remember Wendy from our episode on Fit Strong Women Over 50. It was called New Goals and Dreams with Wendy Green, and I believe it was episode 139.
I'll be sure to link that as well in the show notes. It was really good talking with you today, Jill. I'm looking forward to the next episode of the Fit Strong Women Over 50.
I am too. See you next time. Bye-bye.
Bye.